Good evening and welcome again to Women to Women. I'm Carol Paz, your hostess, and I'm so excited. We have such a special program coming up for all of you out there. But first, I'd like to thank our sponsors for this program. I'd like to thank Villa Basque Deli and Cafe, home of Pete's famous Basque and delicious chorizo right here in Carson City, as well as Carpa Nevada LLC, importer of fine Portuguese olive oils, aged balsamic vinegar, and international health teas. And as a reminder, we're giving each one of our guests on this program tonight one of our 25-year-old balsamic vinegars from Modena, Italy. So I'd like to introduce you to Dr. Kent Gabriel, who is with us this evening, and we want to say thank you, sir, for allowing us to film in your offices.
Oh, you're very welcome,
It's a pleasure.
Carol.
And we have Alicia Idell, who has been a guest with us before, and Alicia is going to be representing all of us women out there in Northern Nevada with some of her questions. Dr. Gabriel is a specialist in plastic surgery, hand plastic surgery, but in general is a plastic surgeon here in Carson City. And so I know there are many of us who have many questions that we'd like to have answered. We'll do our very best to get as many in as possible. Alicia, please go ahead, and with Dr. Gabriel, what is your first question?
Yes, Dr. Gabriel. Some women wrinkles early. They look old, but also feels old and feels very unhappy whenever they look at their faces in the mirror. I have many friends that are in these categories. Now, what would you think is the solution to their problem?
Good question. Anytime someone is concerned about signs of aging, they may be a candidate for facelift procedure, they may be a candidate for less invasive procedures. An understanding has come about in the last 20 years. In plastic surgery, we used to think about wrinkles and skin laxity as being the main issue. We've come to realize that a loss of volume in the face often accompanies aging and is responsible for many of the signs of aging. So in the patient who has early signs of facial aging, and I'll show you an example here of such a patient who has a relatively youthful appearance but has lost volume in the central facial area and is beginning to have lines that come from nose to corner of mouth and corner of mouth to jaw. These patients often can be treated effectively with an in-office procedure that involves adding volume to the face. And there are now a host of agents that we can use to restore volume in the face. Most of them are off-the-shelf agents. Hyaluronic acid fillers such as brand names of Juvederm or Restylane are bioengineered. They're made of the same material that's the background material for our cells in the face, so it's biocompatible. The longevity of these agents varies between sometimes 8 months and a year and a half or so, and they can be injected in the office with a topical local anesthetic. Volume restoration occurs in real time, and you can add volume until you've got enough and stop. And so those agents have become very popular and very useful for early signs of facial aging. We have other fillers that are longer lasting. They're slower in onset. And of course we have native fat grafting. We can borrow fat from the patient from an area that they want to donate and perhaps have a little extra. And we can place it in the face or in various areas in the body. It's interesting in that live fat cells from ourselves obviously don't have immunologic problems. There's no risk of transmitting disease. And fat cells have a certain proportion of stem cells in them. And the effect of fat grafting can be longer lasting than the artificial fillers. And also the stem cell effect can lead to an improvement in the texture of the skin and the quality of the skin. So these are all agents that are available now, techniques that are available now, short of more invasive surgical procedures. Now, another example I'll show you in the patient who has lost volume in the lip. A plump, volumized lip is one of the signs of youthfulness. And we can again use agents from the hyaluronic acid products I mentioned on through to even native fat grafting to add volume to the lip or the nasolabial folds. And this just shows such a patient who's undergone that that sort of treatment. For people with more advanced signs of facial aging, and I'll show you a picture of the classic 60-year-old patient who would benefit from a facelift procedure.
This will be, excuse me, this will be a full facelift?
Yes.
All right.
This is the kind of signs of facial aging that really can't be addressed adequately with just volume restoration. This patient has relatively thick folds extending from nose to corner of jaw and from corner of mouth to jaw. She has some extra skin in the neck, laxity of skin in the neck. This is a patient who needs volume but also needs repositioning of tissues in the face. So this is someone who would undergo a two-plane facelift where an incision would be made around the ear and into the hairline. Skin would be undermined or dissected, and tissues that hold the facial muscles would also be repositioned as a deeper layer, and this helps correct more advanced signs of facial aging. Now we can still use some of the other techniques in addition that we mentioned before. Fat grafting is a very useful agent in facelifting procedures to add volume because the patient is under anesthetic and it's easy to harvest the fat and put it in at the same time.
And healthy.
And healthy.
This picture here, well, she looks like 35 years younger.
Yes.
It's unbelievable what the plastic surgeons can do these days. What about for the elderly? I mean, the 70s.
You know, the age is not so much the issue as the health of the patient.
The health of the
Patients
patient.
who can undergo anesthetic procedures, who are healthy enough to undergo them, who have a positive outlook toward improving their image and have realistic expectations, can have this kind of surgery, even sometimes into their 80s.
Into their 80s?
Into their 80s, if health
I'm waiting.
allows. I wanted to show you another example. It's really not an age issue. It's really a skin laxity issue and a volume loss issue in patients.
Okay.
And here's someone. The previous patient was in her 60s. This is someone who's in her mid-40s. And while some of her signs of facial aging could be well addressed with the fillers we talked about, her neck, I'm sure, is a major issue for her, and the laxity in the neck. And this is someone who, again, needs a variant of the face and neck lift procedure. Not as extensive as the previous patient, but still would benefit from it. If her main concern is the loss of volume around the mouth and those wrinkles, then filler is sufficient. But if she's concerned with her neck, there's really no way to address that problem without surgical repositioning.
Personality changes from
Lot
negative
changes, okay.
to a positive.
Right.
Okay, Alicia, I want to say thank you so much for introducing your questions, and we're coming right back to the second phase of our program with another guest questioner with Dr. Gabriel. So don't go away. These are wonderful questions.
Football is back, and it's your turn to score with Carson Nuggets touchdown to cash drawings, where you can win up to $50,000. Come down every Friday and Saturday for your chance to win big.
Apex SCF provides cutting-edge, hands-on training that effectively addresses today's threats of violence.
The Apex Stay Alive course teaches proven methods for personal protection and attack countermeasures that can be applied in any environment. In your home, at the workplace, or on campus, Apex will teach you the necessary skills to stay alive, including how to recognize and react to an active shooter scenario.
If you knew you had to fight for your life tomorrow, would you train today? Contact us now to sign up for a class in your region.
Hi, I'm Stephen Lincoln with CarsonCityHomes.com, Carson City's original online real estate resource.
At CarsonCityHomes.com, you get effective and easy-to-use tools to help you select your next home today. With our easy-to-use website, you can search listings throughout Northern Nevada and narrow the results by selecting every facet, quirk, and quality you desire. Visit CarsonCityHomes.com. Welcome back to our program for this second portion. We have with us again Dr. Kent Gabriel, whom we'd like to thank very much for allowing us to film this program in his offices here in Carson City, as well as Elizabeth Tully, who's been with us before on the program. Welcome back, Elizabeth. Nice to have you.
Thanks, Kelly.
You know, before we start off, there's this question that's always in my mind that I ask all of our guests, and that is, what led you, Dr. Gabriel, into plastic surgery as a not only a vocation, a calling, but a career?
Well, I think it dated back to my first year of medical school. We had an excellent anatomy department at UCLA, and various surgeons would come in and give lectures on applied anatomy. And the plastic surgery department at UCLA was really world class, and the faculty were superb, and that's what piqued my interest initially. The specialty is really unique in that it's very three-dimensional. So in addition to trying to solve problems that might involve circulation or flow of fluids or other tissues, there's also a three-dimensional aspect to it, and that appealed to me as well. And it's a broad field. You get to operate in many different areas of the body, and that intrigued me as well. So
Okay.
I think that's the reason.
Thank you. Thank you so much. So, Elizabeth, you're representing a number of women here in northern Nevada who are tuned in and eagerly awaiting your first question for Dr. Gabriel.
The term plastic surgery has, for me, a negative connotation. So I wanted to ask you, what's the origin of the name of the specialty?
Oh, that's a good question. The term plastic surgery comes from the Greek plastikos, which means to change. And yes, it's true, many patients have the concept of something synthetic about the surgery, but it really is a change of form and function. And that's the nature of the term.
So,
origin.
what else is next on your agenda there?
Well, I wonder, and you know, it's a broad question or a general question, what percentage of your patients come to you because they don't like themselves, they don't accept themselves, and do you ever turn down patients because you see this is a deeper, more psychological issue than we should be working with here?
That's a very good question. You know, there are patients who have had the misfortune of being involved in accidents or burns or traumas who want to improve their appearance or their function, and that's one group of patients who come. There are patients who feel youthful but don't feel they look youthful, and they want to project a more youthful appearance, and they're concerned with improving certain aspects of their appearance. I hear all the time that I look sad, but I'm not sad, or patients or people I come in contact with say, "What's the matter? Why are you sad?" And I feel like I'm smiling inside, but it's not showing.
Yeah.
And so that's a group of patients that we often can help as well. There are patients who have an altered and abnormal perception of their body appearance. The term medically is body dysmorphic disorder. These patients we try to avoid operating on because we don't help their body image by operating. We just give them something different to be concerned with and to worry about. And some practitioners have a questionnaire that's part of the intake for patients to try and discern patients who have this problem. I always use as an index, if I can't see the problem that the patient's describing to me, it's a huge red flag, and obviously I can't fix something that I don't understand or can't see well. And so yes, we do turn patients down, people who are in transitions under very stressful circumstances, perhaps undergoing a divorce or separation, may be ideal candidates, but it may not be the ideal time for them to have a procedure. And so we'll advise them that, you know, we'd love to help. There are things we can do, but we think you ought to wait until things settle down. Trying to do something to please someone else or to achieve a benefit for someone else is one of the things we want to discourage people from doing.
Okay. I would just like to interject here. Besides working with adults, do you, Dr. Gabriel, get an opportunity to work with children who might have been born with a cleft palate or some kind of a deformity, whether it's through the hands or the foot, do you also have children as patients?
Oh, yes, definitely. Pediatric plastic surgery is certainly a part of the practice. There's a whole spectrum, obviously, craniofacial abnormalities that occur in utero or and become evident at the time of birth, and you've alluded to cleft lip and palate. I have an example of one such patient for you.
Oh, wow.
These are multi-stage procedures. They begin in the first few months of life, trying to close the separation in the lip, dealing with the palate a little bit later in life, and then dealing with secondary issues such as bone grafting of the bones that support the teeth and so forth through the area where the cleft was. These are patients that are with you in practice well into their late teenage years, or or beyond. Another sort of classic one that's a very positive thing for children who have prominent ears. We routinely see patients who have prominent ears, and we try to address the problems before they go to school and might become the subject of unfortunate teasing from their peers.
So you're saying that very young children are a candidate for plastic surgery?
Sure. It's always nice when there are issues that the child can decide on their own they wish to have addressed. When they're later in adolescence, it takes pressure off parents making decisions for them. But there are certain situations, such as the prominent ear child or someone with other major facial issues. In the case of the ear situation, it's interesting. Most 90% or more of the growth of the ear occurs before the age of 5.
Oh, I didn't know that.
So we're able to operate on the ears before they go to elementary school.
Okay.
In this case, the situation is one of cartilage that hasn't folded properly in the ear, and so sutures are placed, and sometimes cartilage is removed in order to achieve the reconstruction.
Just in regards to the rehabilitation or the recovery period, for children who are having plastic surgery done on the ears or with a cleft palate, what are we talking about in terms of healing time?
Well, in the case of the child with prominent ears, we often have them wear a ski band or a headband for about 3 weeks after the procedure when they're sleeping, and in order to prevent trauma to the ear. And that's really about all they need to do. In the case of the cleft lip patient, of course, very small children, we're worried about them reaching up and pulling at the repair and so forth. So often those patients get casted in both arms.
Wow. Wow.
Until it's time for sutures to come out so that they don't disrupt the repair. So there are, children are a special challenge. On the other hand, with certain conditions, they really rehab much more easily than adults do. And this is particularly true in hand surgery in children.
Okay. Well, that gives a lot of our listening audience and viewing audience out there, especially as parents, some hope and guidance that there's a path out there to help their children if they have these situations. Elizabeth, thank you so much for being a part of this portion of our program. And don't go away. We'll be right back with, again, some very intriguing questions that can help all of us.
Join us at the Carson Nugget for The Prize is Right, our 3 million point swipe and win giveaway happening every Sunday through Thursday. You can win up to 100,000 points instantly at our kiosk, and all you have to do is swipe. Only at the Carson Nugget.
Are you looking for a healthier lifestyle? A more nutritious diet? Do you care about quality? If your answer is yes, or if you are just curious, come into Villa Basque Deli and Cafe right here in Carson City, Nevada. Discover fine Portuguese extra virgin olive oils, vintage balsamic vinegars, and a wide assortment of international health teas provided by distributor Carpa Nevada LLC. In addition to these terrific items, Villa Basque is also the home of Pete's famous Basque chorizo, handmade on the premises from Pete's secret family recipe. Satisfy your culinary curiosities. Don't delay.
In business for over 5 years, Play Your Own Music offers music lessons from the best quality music instructors in the area. We also offer band instrument rentals, guitar repair, and we have a recording studio on site. Call us at 885-PLAY.
Welcome back to this third and final segment of our program tonight. We're with Dr. Kent Gabriel and Candace Stewart, who has been a guest with us before. But before we get into these final questions, I'd like to say thank you so much to carsonnow.org, which is the on-site internet place to go. When you want to know what's happening here in Carson City, it's carsonnow.org. And we'd also like to thank the Nevada Appeal and the Record Courier, who always support our local businesses and encourage us to shop right here in the Carson area. So let's return to our guests and our final questions. Again, thank you so much for allowing us to be here in your offices, Dr. Gabriel. Very generous. Carol. Thank you. So Candace, what kind of a question do you have for Dr. Gabriel?
I actually have a couple of questions regarding carpal tunnel syndrome. First of all, I wanted to know what is the newest treatment for that. I can remember when people had terrible scar, in the middle of their hand, and I was just wondering if there is a newer treatment for that, and exactly what causes it. Can it be avoided?
Well, we'll start with the easier question first, which are the procedures for carpal tunnel. The two time-tested procedures for carpal tunnel are open carpal tunnel release and endoscopic carpal tunnel release. The open carpal tunnel release can use an incision that's limited in scope. The endoscopic carpal tunnel, depending on technique that's performed, may either use a single incisional site or a double incisional site. There really haven't been dramatic advances in the invasive treatment of carpal tunnel syndrome. About 2/3 of board-certified hand surgeons in the country do open carpal tunnel release and are no longer doing endoscopic release. About 1/3 of board-certified hand surgeons still do the endoscopic release. My view is, and I think many of the members of the Hand Society, that there is a higher complication rate associated with the endoscopic carpal tunnel release. It's hard to get a handle on exactly what that is. Several years ago there was a questionnaire sent out to members of the Hand Society because they tend to see the more complex cases or cases that are referred with complications. And what could be gathered from the survey is that there is a higher complication rate with the endoscopic approach, both in terms of incomplete releases of the carpal tunnel, nerve injuries, tendon injuries, and even some arterial injuries from the procedure. Now, having said that, people who do it regularly and like it are very comfortable with it and feel it's a good technique. At 3 months following either technique, there really isn't a difference in outcome if they're properly performed, but I just feel there's a little bit higher increase of complication with the endoscopic approach. There may be a return. The original hope with endoscopic is that return to work would be faster. Return to work on average is about a week faster than the open surgery, but to me, if you get a major complication like a nerve injury or a vascular injury, the fact that some of your patients got back to work earlier, but others may take a year or more and may not fully recover, to me isn't a worthwhile trade-off. So I do the open procedure.
Dr. Gabriel, in addition to what you're saying right now, are there certain occupations or areas of work where we find more carpal tunnel?
It's a very good question, Carol. The concept that the introduction of the keyboard in American society has been responsible for the phenomenal increase in carpal tunnel surgery was an assumption that many of us made, but prospective studies that have been designed to look at it are not really showing a relationship between typical office work and keyboarding activities and the development of carpal tunnel syndrome. Certainly, OSHA has identified some very high-risk industries, slipper manufacturing, certain automobile manufacturing trades, red meat processing, poultry processing, activities where there's assembly line work, there's a lot of force involved in hand and wrist movement, where there may be vibration exposure or cold exposure. Some of these industries have an incidence as high as 1 in 11 workers developing carpal tunnel syndrome. So clearly there are causative factors in the workplace. The problem is that what we assume to be the more typical causative aspects of carpal tunnel, such as keyboarding activities and so forth, don't seem to really pan out.
That's kind of surprising, isn't it? Because
It
it's a
is.
repetitive action on the keyboard that people use hour after hour in office work, and that was just kind of an assumption on the part of the public that that was the
Right.
culprit, and it's not necessarily the case at all.
Right.
Do you have another question, Candace, that you'd like to ask in terms of plastic surgery?
I do actually. I've seen a lot of things on TV lately regarding something called a lifestyle lift. And I was wondering, what is the difference between the lifestyle lift, which they seem to say is not as dramatic or it's done differently than a regular facelift? I just wondered what the difference is.
Well, the lifestyle lift fits into a category of a number of plastic surgery business ventures that are going on in the country. It's an attempt to deliver a service at a low cost to patients or lower cost to patients. The reality is that many of the patients that at least I look at in their examples have really had significant procedures that are akin to a standard facelift procedure. These are not hour-long procedures. They're not procedures that occur at lunchtime and someone goes back to work. And in a lot of what I see, at least on their websites and so forth, they don't really tell you what procedures the patients had. And often someone may look globally very good, but they've really had a number of interventions done that aren't necessarily simple procedures. So on the one hand, I don't think there's particularly magic associated with the lifestyle lift. There is an attempt to do the surgery in a relatively quick period of time in a relatively low-cost environment, and results I think vary as they do in any surgical procedure. I think one of the problems is that sometimes the surgeon actually performing the procedure may not have been the one that initially evaluated the patient in clinic, and to me, what appeals to me about taking care of patients and what appeals to my patients is a continuity of care. Number one,
Absolutely.
identifying the individual features that the patient may desire corrected, having the artistic insight to decide what should be done, executing it for the patient, and then following the patient afterwards in case there are things that don't meet our expectations or that we can make better. The surgeon that took care of you has exactly the knowledge of what happened in the surgery and what may be done to correct the situation. I don't know how the continuity occurs in that particular setting, but I suspect it's not quite the same thing as having the same person follow you through
The whole thing,
start to
right.
finish.
And Dr. Gabriel, maybe I could ask this question real quickly because we're running out of time. If we're going to have a form of plastic surgery, such as a facelift or an eyelid lift or something that pertains to the neck and the face, is there a regimen of health or diet that we can follow that would make a difference in the results?
Well, obviously good, as we alluded to in an earlier segment, good health is a prerequisite to safety in these procedures. There are certainly a number of homeopathic medications, vitamin supplements, and so forth that we advise people to stay away from immediately before surgery. Vitamin E, certain other supplements can increase bleeding time and cause other complications. So those are things that we advise people of prior to surgery.
Okay, and I think I hear all of us saying that when we take a step, we've made a decision, it's really best to go to a solid, well-known area plastic surgeon who's going to see us through a lot more than just the surgery itself. It's the aftermath. And I think that's very reassuring to us to know that we have in our community a dedicated doctor and one who has performed some very special effects on a lot of us. So I want to say a special thank you tonight, Dr. Gabriel. Thank you so much.
Thanks for having me.
Thank you, Candace,
Thank you,
for being
Carol.
a part of our
Thank you.
panel. And thank all of you out there. And we'll be back again next week with a very special show. So continue to watch Women to Women as the program grows with some very unique guests. And I think we've demonstrated that tonight. So have a good night. Stay safe. Good night.